Awesome. Thanks, Jamie. I am TJ Hartridge, the current Wilderness Medicine Fellow at the University of Utah, and I'm going to get some slides up here just so we have something to look at instead of my face. Well, what we're going to be talking about today is avalanche awareness and this idea that we can, with a little bit of understanding of what this is and what avalanches are, we can hopefully lead to a lot of preparation and avoidance and prevention of the avalanche accident. And I will say, being in the state of Utah, it is pretty impressive with how many people backcountry ski in relationship to how many incidents we do have. So I think whatever is going on in the community here, there is a lot of effectiveness in regards to getting the word out. But I am also one of the new fellows in the American Academy of Wilderness Medicine. I just got that achievement as well. And avalanches are something that I hold very near and dear to my heart. I have been on numerous calls with them in my previous career as a professional ski patroller. I have started again with Snowbird Ski Patrol, and we are working to mitigate the avalanche hazard. Got to go back on some routes, and we'll kind of talk about what avalanches are. So if there is no understanding of what they are at that point, we can go from there. And then we'll talk a little bit about how we can start to get into backcountry skiing and some of the context of why we care about this. I love a conversational approach, very Socratic. So if there are comments, questions, interjections, concerns, let's definitely have the conversation, and I encourage the discussion there for us. So, zero financial disclosures. What we're going to talk about today is kind of what is an avalanche, why we care, what can be done for preparation, and how we can start to look at avoidance. And then we'll talk a bit about companion rescue, go into just a little bit on what the recommendations are for resuscitation, how to consider evacuation, so getting out of the circumstances if the terrible situation were to occur, that you or someone in your party were to be caught in an avalanche, and then just a comment on recovering, kind of how to go forward after that. Before going too much further, though, these are some of my mentors that I want to give a big thank you to. Scott McIntosh, who I actually think I see on the call today, has been one of my mentors for the last 4 years, honestly. But I've gotten to work very closely with him over the last year in developing some of this content and going forward with that. Colin Grissom, Michael Buchanan, AJ Wheeler, and Will Smith, also very involved in avalanche education. AJ and Will are up at the Teton County Search and Rescue and the Jenny Lake Rangers, and they've done a lot to help kind of push this education forward. Michael Buchanan is one of the organizational partners. You saw that little URL at the beginning. Aftertheavalanche.org is just a program that we're in the process of developing to make this kind of first aid training in regards to avalanche accidents more available. And then Colin Grissom has been a huge impact in this whole community as well, by contributing his knowledge and expertise as we've developed a lot of these things. So what is an avalanche? Well, pretty simply, the way that I think about it, it is a lot of snow or a little bit of snow or some snow and ice or some blocks of snow moving downhill. So really, quite simply, moving snow can be considered an avalanche. And we could go super far into the weeds about the different types of avalanches, whether they're loose or consolidated and slab-like, whether they're wet or whether they're dry. And all of that depends upon when in the season, what the weather's been doing. And we'll talk a little bit about the framework and how I was taught and how I think it's just a nice mental model to think about avalanches and what we would call the avalanche problem. So what are the contributing factors that create this issue for us? And more importantly, we might not all be backcountry skiers or snowmobilers or snowboarders, but there are a lot of people that are just into backcountry or into resort skiing. And this right here, it'll play for me. Oh. I apologize for the language. But this is inbounds at Mammoth years ago. All quote unquote controlled terrain. And I'll kind of say why it's a quote unquote
avalanche.
But you see the avalanche happen there. Snow breaks away. The skier gets caught. Inbounds, mind you.
Okay, floating.
Tries to stay on top of all the moving snow. You can see how it's kind of going over him. This individual ended up being very lucky that he was able to keep his head up, swam against it, and stayed up above the snow surface. But when we think about inbound slides, they really, we hope that they don't happen. But the reality is is that we're dealing with a very complex, very intricate problem here. So avalanches are made based upon the weather, the snow, the terrain that is involved. And ski patrol is designed to go out and control these areas, and we try to do the control work. So that means ski cutting. So we actually ski through the start zones of avalanche paths to try to push the snow and get the avalanche to start naturally before a skier that's not expecting it goes into it. We use explosives, we use snowcats. There's tons of different what's called mitigation techniques, but the idea is that we want to try to decrease the risk. But unfortunately, out of the more than 250 avalanche fatalities in the US that took place from 2008-2009 season to 2017 to 2018, 8 of them occurred inbounds when it comes to these fatalities. And these statistics come from the CIC and the National Ski Areas Association as they look at North America and the US ski industry as a whole. And 6 of those deaths happened inbounds that was open to skiers at the time. So there were a couple of deaths that occurred in areas that were closed terrain. So the problem was not fully mitigated to ski patrol and their hopeful standards there. And when you look back even further, from 2000, there's been about 21 skiers that have been killed. And I share this not to scare you, because ski patrol is out there doing their job. They're trying to make these avalanche happen before people get to them. They're trying to control the terrain. But as a recreational skier or snowboarder, it's good to know what is considered avalanche terrain, good to understand what the avalanche problem is when it comes to the new snow, and just kind of to be aware that this is something that can happen even if you're skiing inbounds. And Ethan Green is a previous mentor and someone that I got to work with in Colorado quite a bit in my previous life. And he's quoted in this article that kind of covered all of these different fatalities. He doesn't want people to not have confidence in ski areas, but it's important to note you can't reduce this risk to zero. And that's very true. There's a lot that goes into trying to understand, to prepare, and to avoid avalanches. And this symbol right here always really resonated with me. It's called the Avalanche Data Triad. And it really just is a simple memory tool to kind of look at, well, what goes into an avalanche? Well, on this left side, we've got terrain. So we need to have terrain that's going to be at an angle that's steep enough that if snow were to accumulate and create layers, is what they're called, from the different storms and from the different weather events that happen, the snow can have strong layers that sit on this over a weak layer. And if the angle's right, so 30 degrees or greater to about 45, 50 degrees is kind of the general understood angles. So most black diamond ski runs that people want to be skiing on, or double black runs, if it's that steep, then you can have the potential for an avalanche to happen. There have been occasions, though, where the angle goes even lower, so less than 30 degrees in the high 20s. And when the snow is just right, the snowpack is so weak, you can have avalanches happen there. We also think about terrain because of what is in the terrain. Are there trees? Are there rocks? Are there cliffs? Are there gullies? And what we would consider terrain traps. So does it make the hazard even higher if something were to happen? If someone were to be caught and pushed around in that moving snow that is the avalanche, would the consequences be higher because they got pushed off a cliff or down into a gully where the rest of the snow would then pile over them, making them an even deeper, deeper burial? Then we think about, how does the weather kind of build avalanches, and what is the weather doing? Normally we need snow, and that's kind of obvious in that regard. So once the snow has fallen, what's happening to the snow from there? There's great quotes out there that wind is the architect of avalanches, because the wind will move that snow. It can take it from one side of the mountain and put it onto the other side, increasing the amount of snow that's there. It can push the snow into a more solid, cohesive slab, which can be something that's very strong. And when we talk about snowpack in a second, strong over weak is where we start to get that area for a potential avalanche to happen. And I'll kind of clarify that in a second. Or has it been sunny throughout the day? So how are the weather patterns affecting and building the avalanche problem as well? And then once the snow has fallen onto the ground, we have this little base layer down here at the bottom called the snowpack. So those lines that are at the bottom, kind of representing that we need strong layers over weak layers. And sometimes the strong layer is the same snow that came in. It's at the right moisture. It coheses together. It bonds really well, and it creates a nice storm slab is what it's called. And that's the problem that we're mainly seeing right now up in the Wasatch and up in Little Cottonwood. Or has it been no snow, and it's been sitting on the ground and it's had a lot of sun, and we're seeing energy that's moving through the snowpack. And with energy, we see change. And with that change, there's a really cool process, and it's super dorky, called granular metamorphism, which is way beyond understanding for this class, but it's what's actually happening to the snow crystals. Are they getting stronger or are they getting weaker? If they're getting stronger, the process is called rounding, and things are kind of bonding better. And the snowpack, if it's all doing that, makes it much safer, and it lowers the avalanche problem and the risk. If it's going towards what's called faceting, then the rounds are kind of getting bigger. There's more air getting between them. It's starting to get weaker. And that process can also come from what's called surface hoar, or depth hoar, is once it gets buried in the snow, and it can be big, kind of weak crystals. And if you've been backcountry skiing, or if you pay attention to some of the accidents that have happened, you'll hear this term persistent weak layer get brought up a lot in these big, scary avalanches. And that weak layer is something like a faceted layer. It feels like sugar, like kind of granulated, big, thick sugar. It doesn't stick together. You can't pack it together. And that can be a very weak layer that's hiding under all the snowpack. And then obviously there's us right in the center of it all, because we don't really care if avalanches happen if it's not going to affect us, whether it's going to affect the road or whether it's going to be us that's skiing in it or snowboarding in it that gets buried. And how we understand this problem and how are all these things working together is how we can really be prepared by understanding what's taking place. And locally, we have the Utah Avalanche Center that when you read those reports, when you look at that daily forecast, you're going to see terrain being discussed, whether it's the aspects. So kind of, are you north? Are you south? Are you west facing? So is there more sun? Is there going to be more wind, depending upon the weather? And it'll talk about the weather, the terrain, the snowpack, how they all interplay, and kind of give you an idea as an individual, what do I need to be doing from a caution perspective? Is this a moderate day where there's a good chance that something could happen, but it's still not as dangerous as considerable or high or extreme? Or is it a low day where, it'd be very surprising if we were to see an accident happen today? So this is kind of just the general framework. And that's the very brief introduction into kind of what goes into making the avalanche problem there. But to really be prepared, you need the knowledge, you need the gear, you need to know the group that you're going to be with, and then having the plan. And the best way to start with these education is with the proper training. And a lot of them come from, in the United States, we have what's called ARI, or the American Institute of Avalanche Research and Education. We have AAA, the American Association of Avalanches, or American Avalanche Association. Locally, we have the UAC, and then every state that has a reasonable group and sizable kind of backcountry community will have their own forecasting centers as well. And usually they're done in conjunction with the roadways and kind of a large group effort there. But ARI and AAA, they really are the groups that are trying to research, trying to understand, and developing the curriculum that is out there. So if this is interesting to you, this is my plug, and there's no financial disclosures, but starting with a recreational level 1 through ARI, and it's about a 2-day course. A lot of it is done online now to get the base knowledge, to learn about granular metamorphism and weather and snowpack and terrain choices. And then it has a couple of days that you can go out into the field and you can really apply the skills. You can spend time with a guide, looking at the terrain choices, looking at how your group is traveling, looking at what the weather is doing and making these observations, and just trying to build your understanding. And I strongly advocate that is a base level minimum course requirement if you're going to get into backcountry skiing, or if you're going to go play in avalanche terrain. Then, to be really prepared, I am a huge advocate, obviously, for medical training. I personally went through the Wilderness Medicine Institute for my first WFR, Wilderness First Responder, and that was almost 20 years ago, turns out. But that became the base foundation of my medical education, because I think they're very well done. And I know WMA is very good. There are a lot of good ones out there. WMS, the Wilderness Medicine Society, offers phenomenal resources. They also have a really good kind of evidence-based review and expert recommendations on avalanches, prevention, and first aid. And we're going to touch upon a little bit of that through here. So getting the education and the training. And then there's always kind of the day of. Once you've got all that and you're going to actually go do a ski tour, you're going to go on a hike out into avalanche terrain, knowing your local forecast. And that's where the Utah Avalanche Center and those other organizations come into effect. So you're getting the education, and in the process of getting the education, you have to look at the equipment. And there is quite a bit of equipment involved in the process. There is one word is how I was always taught, but beacon, shovel, probe. So those three pieces of equipment is really just one, because you can't have any kind of effective rescue if an avalanche were to occur if you don't have the right rescue equipment. So that you can see the shovel and the probe there. That little brick kind of looking structure that has the numbers on it is called an avalanche transceiver or an avalanche beacon. And it will send out a signal constantly throughout the day that others in your party could switch to receive, and they can receive the signal and allow that to kind of follow you. And it'll kind of bring you in on a track, essentially. It'll try to hone down and get you a little bit closer to where that person might be buried. And we'll talk rescue here in a little second. And then you need the probe to get even a more accurate kind of pinpoint location for your patient and your victim. And then you need the shovel to effect the rescue there. Then you've got a bunch of other ancillary pieces of equipment that are all very important. I'm a huge advocate for the radios and having two-way communication between everybody in your party, so you know where people are. You have a better understanding of how the terrain is up ahead. Once you can talk to each other, you know when people are getting into safe zones. Then having the first aid, having an airbag as well. The airbag is kind of interesting. It's based upon this idea called granular convection, or as I was initially taught, the Brazilian nut theory. If you take a bowl of mixed nuts that sit on like the bar top and you shake it, the Brazil nuts will naturally kind of ratchet themselves to the top as the smaller particles will fall underneath it. And there's an elevator effect. And essentially, that's what we are trying to achieve with an airbag, is the skier or the rider that's in the avalanche getting caught up in this tumbling mess of just snow, like being in a washing machine with washing machines moving downhill with you. You want to be the bigger particle. And that's where this airbag becomes a really effective tool to try to bring you up to the surface, decrease your buried depth, and make it a little bit easier to hopefully identify and find you. And then also it can help create an air pocket. So the reason why we care about avalanches, obviously, is if you get buried in one, you are essentially entombed, you are encased in very, very solid snow. Once the process starts and the snow starts moving, it's going to settle quite a bit and kind of like harden around you and put you into this position. If you have the airway, then that is one of the best ways to try to prevent the worst case scenarios, which would be obviously death in this case. Then the other tool that it's falling out of vogue a little bit, the airbag I think is becoming more practical, is the Avalanche, but it's some kind of a rebreather technique. When I patrolled professionally for years, this was a mandatory piece of PPE, personal protective equipment, because the thought being, if you have that in your mouth when you're buried, you will be able to breathe through the snowpack and you will be able to stave off that asphyxiation there. Helmets as well, just general protective equipment. If you can protect your head and decrease traumatic injuries to your brain, then there's a chance you'll be able to maintain consciousness longer, decreasing the chance of death from trauma or asphyxiation. And then there's the picture in the lower right corner there, and those are individuals that are hiking uphill. And this is to kind of further reinforce that if you are backcountry skiing, the ability to move in the backcountry, whether it's on your skis, uphill and downhill, or with snowshoes, whatever it might be, you'll need to get to, and you will need to kind of move through the terrain to get an effective rescue a little bit quicker. So let's say you've gone through the course, you've taken all the necessary trainings, you've practiced with all the equipment we have listed here, and you and your friends want to go out on your first backcountry ski tour, but unfortunately, in the middle of the tour, tragedy strikes. A large avalanche happens and someone is buried. What do you do? Some of the recommendations, and this is coming from the Wilderness Medicine Society guidelines here, they've set out a really nice framework and have some good algorithms about how to go through this. And first is establishing leadership. Hopefully it's not just you trying to rescue your partner. I don't want big groups in the backcountry because that's more to manage, but if you are In more considerable terrain and hazard, having a party of 3 to me is ideal. You've got 2 to effect a rescue. You've got 2 people to be extra excited when the skiing's really good and safe, but establish leadership and make sure you have kind of a clear direction on what you need to do next. And then I can't harp this enough, but scene safety. If an avalanche has occurred, there's a strong chance that there's still avalanche hazard that is present around you to some extent. Once you've got a kind of a visualization, you've made sure the scene is safe, looking over the entire surface. So looking over that whole slide path and seeing, do you see gloves? Do you see a ski pole? Do you see a head from someone sticking up? Do you see the big red airbag balloon towards the bottom of the slide? Those would all be places to go first to search for your potential friend and partner that's buried under there. If your surface search is unreliable or you don't see, or you've got multiple buried, then you're going to have to move through this process with transceiver search. So that's when you turn your beacon on and you'll start moving through the terrain. And those are the pictures to the upper right. If the slide path's not wide, you can kind of just go right down the middle, knowing that you're going to be getting both sides of the debris. If it's bigger and it's just you, you might have to kind of do more of the zigzag pattern that you see there in the center. And then multiple searchers, you've got more people involved, you can spread out a bit, you can have more people using the beacon, going down the slide path, trying to make sure you're just covering all the areas that are present there. And then the pinpoint probe search, this is what we're seeing in that picture kind of right in the center, is having a systematic way that once you have your lowest numbers on the beacon, and we could talk for an hour on how to use a beacon, just knowing that this is part of the process and the training is hopefully kind of sparking your curiosity to learn more. The pinpoint search, though, the probe will come next. You'll try to get even closer. And then depending upon how deep that patient is, there's a fairly large task that's coming ahead. And that's this idea of strategic shoveling, is you actually have to get to your patient. And that's what this little diagram in the lower right is depicting. You've got someone that's digging up to the probe. So you want to kind of start downhill, use gravity on your side to move the snow away. And you could be moving tonnage of snow to try to get to that patient's airway. And that's the whole goal. Now, at this point, we have a patient that we want to make sure we get to their airway. And this is going to be one of your patients where once you get to them, we're going to be looking for the ABCs. Is their airway intact? Are they breathing? Do they have circulation? It's a little different from our new CAB for American Heart Association there. So why does this matter? We've touched upon it a bit, and why companion rescue is so crucial. And it's really this notion that if your victim is buried for more than 15 to 20 minutes, the survivability goes pretty much to zero most times. So you can see probability of survival there with 100% at 0 minutes and 0% pretty much most places over 35 minutes there. And this is the way that there's a bunch of different graphs there. It's looking at the Swiss, it's looking at the Canadian, it's looking at each one of our individual snowpacks. And there are, just as you can imagine, California is having feet and feet and feet of snow. That's called a maritime snowpack. We are more in this transitional intercontinental, and we get a little bit more depth and we have a little bit more consistency to our weather. And then going even further inland to Colorado, it's more continental, it's shallower, it's drier, and it's usually colder. And you see different avalanche problems and different hazards at those points. And this is just trying to reiterate, you see the same kind of decreased survivability. The idea, I think, with the Swiss having a little bit better survivability and longer time frame there is I think they've got more training overall in their community and in the culture there. The terrain is a little bit more open. There's less trees, there's less things to hit. Trauma doesn't have as much of an impact on it as well. I think also the culture there is much more on airbags and having all the training and education. And then they've got a lot of resources that are very close when it comes to air medical. And that's all just based upon population density. Takeaway from this slide, though, is if you're not the ones doing the rescuing, if you and your group aren't the ones that have been gone through the training, practicing the skills of using a beacon, probe, and shoveling, and having some medical knowledge on what to do once you get to your patient, survivability is quite low if you're waiting for ski patrol or search and rescue or Wasatch Backcountry Rescue to get on scene. And what kills you in an avalanche? 75% asphyxiate. About 25% of the deaths are associated with trauma, and then less than 1% would be considered secondary to hypothermia. And these are just rough numbers that continue to come out in the data. And they definitely fluctuate a little bit geographically. I think in the United States and in the North American models, you see a little bit more traumatic causes of death and a little bit less. Asphyxiation is still can always be argued as contributing, but a little bit less on the asphyxiation here, just because we do have more traumatic influences, I think. But asphyxiation, so 75%, it's due to that insufficient oxygen supply. So the body has that rebreathing of the expired air because you're into a packed space. This can get worse if that air starts to, that condensation starts to freeze around you and can form that mask, or you have physical airway blockage. So as we were talking, you're caught in this slide, you've got snow moving everywhere, can very easily get packed into different places. The larger the air pocket will also affect survivability in this case, though. And this is something that is really important to note if you are responding to a scene, is did they have an air pocket? If they had the ice mask, then it's safe to say that they probably were breathing under the snowpack for a period of time and were alive at the time of burial. So it wasn't an immediate death from some traumatic cause. However, it doesn't bode well for the long-term picture that mask formation did occur, and they most likely died of asphyxiation. So you're looking at a little bit different timeframes there. The severe trauma as well in this case, it kind of coincides. It can definitely hasten the asphyxiation process if you have severe head or chest trauma, because your breathing can be affected, your level of consciousness can be affected, your will and ability to kind of create an airspace in the process also can decrease. And then as we were talking about, less than 1% due to hypothermia, the idea being is that it takes a very, very long time for you to cool down. You'd have to have a significant airway, be relatively atraumatic for you to succumb to that. And we'll talk in a later slide about why that's important, because this will change how we think about it, especially once these patients are extricated and in the evacuation process and they make it to the University of Utah or IMC or another hospital that's local, and what will happen there. So here is just a quick demo. This is a video that we've put together. It's going to play.
All right, let's get that airway. I think I got her helmet. I think I got the helmet here. Ellie, can you hear us? Ellie, awesome. Okay, she's drowning. I think we've got an airway. She's responding to us. Let's see if we can get the rest of this out so we can get. Okay, Ellie, are you okay? Okay, she's talking to us. At least she's giving us some responsiveness. Okay, Ellie, is anything hurting you? Okay, all right, she's got something hurting. Let's see if we can. Yeah, perfect.
So just kind of a quick video there, but like once you get to that patient, we prioritized airway and evaluating that. We were then able to determine that there was a level of consciousness. And if you noticed Michael in the back there, he was continuing to build a platform, and we were trying to create a space, because ideally you're going to get to this patient in a good window. You're going to be able to get to them and introduce some basic first aid, have a space to care for them as well. Bringing us to resuscitation. And there's a couple of different really good algorithms out here that just talk about how to care for an individual that's caught in an avalanche. The one that you see here on the right is from the Wilderness Medicine Society expert recommendations, and pretty systematic. This one definitely takes you to another level when it comes to the medicine, though. It's talking about ALS algorithm initiation. It is talking about serum potassium and making that determination for where they might go. Another very strong resource that was developed with Scott McIntosh at the University of Utah, as well as Manuel Gaswin, is from Avalanche. And we are trying to do more in working with them and getting their information. So a lot of the information that I share is coming from both of these algorithms. And what Michael and I did was just try to create a really simple approach. And this is kind of the synopsis that we've come up with. And there's a lot of different ways to look at this, but we want to get to the patient's airway, and we want to look for signs of life. So when we say signs of life, are they responding? Are their eyes spontaneously opening? Do we feel and do we see evidence of breathing, that look, lesson, and feeling? Can we appreciate chest rise? Do they have pulses? And taking into account that we would give this person, depending upon the time of burial, if it was a really prolonged burial, we would give them a little bit more of a time to evaluate. Hypothermia kind of slows everything down, like you're going into stasis, essentially. you're slowing everything down. So we want to look for that really slow respiratory rate. We want to make sure that we're giving a really good effort trying to feel for a pulse and checking that for potentially up to a minute to make sure that we're feeling that's what we're feeling. If we have signs of life, then we kind of go to the left here and we support breathing. So what we're trying to do there is obtain ideal body position so they can expand their chest. We're going to make sure that the rest of the snow that could be packing them in and preventing chest wall expansion has been cleaned up. We'll consider doing the rescue or recovery position at this point so they can continue to protect their airway and breathe as we finish the extrication, getting them out of the snow, and then trying to figure out how we're going to evacuate them next. We'll look for injuries, just real simple head to toe, checking and pushing on, looking at if we're worried, exposing everything head down through the feet. And then we'll treat and prevent hypothermia. So if there's a ton of wet clothing, we would consider potentially changing that. We would try to get them as dry as possible, get them insulated. And as morbid as it might sound, we will use that extrication, that hole that we've pulled the patient out of, and hopefully have that nice platform with walls as a windbreak and as a potential shelter as well, because it might be, hours until someone could come and help us. And then we'd make sure that help is on the way. And if you remember the slide previously, I never talked about when you'd call 911, and I'll go back just to kind of show you again. We never talked about when you'd call 911 in this whole sequence of events. It's because really the priority is going to be getting to the patient and the patient care first and foremost. So once you've got the medical care, you have a stable patient, that's when somehow getting emergency medical services notified. Now, obviously, if you have multiple people in the group, sending someone back up the ridge or making sure that someone's able to call out for help early on in the process is going to be ideal, but that's not always what's possible in these situations. So if they don't have any signs of life, then we kind of go through this algorithm here. And a lot of this is taken from the WMS and the Avalanche algorithms there. You're going to open the airway. And when we talk to individuals that have gone through their Avalanche courses and they just need some basic first aid, Michael Buchanan and I really believe the jaw thrust is the simplest way to open the airway while still taking into consideration a possible C-spine injury. It's going to pull the tongue forward. So we want to kind of put the fingers behind the angle of the mandible. And we've got a little picture here. After you've cleared the snow out of the airway, upper right there, you can see fingers behind the angle of the mandible there, trying to pull that jaw forward, pull that tongue forward, and trying to open that airway up. This is also a good opportunity. If you open that airway and you start to see spontaneous breathing and you need to maintain that, but you want to make sure you look for other injuries, that you have some evacuation plan. An MPA is a super light and can be very effective tool in the backcountry for just helping with a little bit of airway management in this case. So if you don't have any breathing, then we need to give some rescue breaths, and we're going to breathe for them. And this is coming from the Avalanche curriculum here, and giving 5 rescue breaths and determining if we can get their respiratory drive restarted. Most likely, if it was an asphyxiation, if they died from lack of oxygen, if we can get that respiratory drive reinitiated, there's hopes that if they were, kind of slowly declining there, we might be able to stop the decline there, get their heart working again, get them breathing again. If the 5 rescue breaths, though, are not effective, then this is someone that we would potentially have to go down and really go for that full pulse check there. If we do not feel a pulse after giving it a solid minute, then we need to start CPR. And this is always something in the backcountry that is a little harrowing and can be a very concerning situation there. If we do have a pulse, though, then we're going to continue the rescue breathing for them. We're going to treat their hypothermia, and we're going to ensure help is on the way. So when it comes to CPR in the backcountry, if you have one patient in one burial, giving them the full effort is going to be warranted. If you've got others, there is a caveat, and this is coming from Avalanche. And if Dr. McIntosh is still on the call and wants to further elaborate, he was one of the brainchildren behind this whole idea. But 6 minutes of CPR, if you're in a kind of worst case scenario, multiple burial, and you're trying to do the greatest good for the greatest number, we should attempt 6 minutes. And if we are not seeing signs of life, if we do not have ROSC at that point, then it's reasonable to move your efforts towards another buried victim. And this is taken into account if your burial depth was super, super deep, if they were multiple meters under the snow, the futility in that rescue is just going to be harder. And it's one of those realities, unfortunately. So I know that's kind of an interesting topic, but I do think when it comes to avalanches, it's an interesting one because it really is trying to do the greatest good for the greatest number there.
Yeah, hey
Another,
TJ, this is Scott. I'll put a reference for that and
yeah,
for Avalife in the chat.
awesome. I love it. We've got the source and the talk. That's the best. The other thing to think of is our time of burial in regards to, are we entering into that period of a hypothermic arrest? So if we have someone that's buried longer than 60 minutes with signs of life, and we saw a big airway, we have a pulse, we have something, then this is the patient that we really need to slow down, take it very easy. We want to handle very gently. This idea of rescue collapse can occur where you start to move them, you start to jostle them, they can have cardiac instability, their heart can be so cold that it can be very irritable. It can very easily go from the arrhythmias that come with bradycardia into ventricular fibrillation. Kind of switch over. We want to keep these people flat, and we want to kind of avoid our movement if we can until we're able to do it in a very thoughtful, meaningful way. And we're going to want to monitor them super closely, do all the other things you do for a hypothermic patient, such as insulation. If they are alert, if they are oriented, these would be people that feeding would be appropriate if you believe them to be able to keep their airway patent and open, and you don't think that they would aspirate or kind of choke on any of their food, giving some fuel for the fire there. And then being mindful, if they've been buried for that long, their hypothermia could be fairly severe. You would want to go into CPR if they became pulseless, further unresponsiveness, things of that nature. If they're buried for greater than 60 minutes and they have no signs of life, then this is where a really thorough airway assessment becomes very important. We want to make sure, did they have any idea, or do we have any idea if they had a solid airway, an air pocket that was big enough to sustain them? And if they did, if their mouth wasn't blocked with snow, if they had the air pocket, and we're in this greater than 60 minutes, these are the individuals I would suggest we err on the side of caution and say, this could be from hypothermia. And this patient deserves CPR, they deserve evacuation to an area that will do ECMO or extracorporeal life support type. So the university is a great example of that. However, if that airway was blocked, if they had snow deeply packed into their mouth and into their nose, if they had a big ice mask that was formed right over their face, those people probably died of asphyxiation much, much earlier in the 60-minute window that you were looking at. But if it's greater than that with an airway, yeah, CPR, transport, ECLS, because this might be a reversible cause of death. Some of the ways that we think of hypothermia, just a quick plug, it's not a hypothermia talk, but when we're talking about winter sports, it's always good to kind of review the ways that we gain and lose heat. So radiation, we can gain it from the ambient sun, from each other as well. Convection is through that wind or water moving over us and taking energy. Conduction would be through direct contact. And then evaporation is one of the only ways that we just only lose heat. And that's through that water evaporating off the skin, obviously there. But radiation, convection, conduction, we can do a lot to try to prevent. So getting the blankets, one of the things that I usually always carry is a little reflective space blanket bivvy, using that to help prevent. Getting them dry will prevent further evaporative loss. Getting them up off the snow can prevent that conductive loss. And taking advantage of your little snow cave rescue platform, if the scene is still safe, to prevent the convective losses there. And then we kind of already talked about rescue collapse, but it's that very, very unstable, peristable, cold patient that if you move them too much, we can get cold. Moving back, we can get that cardiac instability and just see kind of a further decline after the rescue has started. One of the topics that unfortunately does come up, though, is when would we withhold or when would we stop any of our resuscitation efforts? If it's obvious that they have died, you see big, massive trauma, the obvious signs of death, we don't have to harp upon them here. That would be a reason not to start or to stop your resuscitation. If there was that greater than 60 minutes with no airway, if you've been in the backcountry now for 30 minutes, you have no ROSC, so no return of spontaneous circulation, no evidence that life has returned, that would be another indication that you could safely say we've tried everything we have and we just need to stop. If at any point the scene is no longer safe, if additional snow starts falling, weather starts changing, you see more avalanche activity around you, and you're concerned that you could potentially be involved in another slide, that would be a reason. If you just can't physically perform CPR, if this patient has been buried long enough that their chest is frozen and non-compressible, that would be very hard to do CPR for. Or if someone else comes on scene and is able to help take over from the medical professional standpoint there. Let's say that all of your efforts paid off. You worked super hard. You got to that patient very, very quickly. All of your training worked. They had an airway. You were able to assess them. They were still alert. Now you need to figure out how you're going to get out of the situation. Helicopters are obviously amazing tools, but I will say they are finicky. They are very weather dependent and they cannot be relied upon. And when you start to learn more about search and rescue and how these organizations operate, the helicopter is ideal, but it is not the only plan that's in place. There are always teams that are working towards you in one other way, whether it's on foot or by snowmobile or coming in from the ski areas from above. There's other ways. They're always trying to think, because these helicopters cannot really be relied upon. A good example would be if there was something that happened yesterday, the wind was howling, there was fresh snow falling, the cloud cover was low, no helicopter could fly in those conditions. So thinking of other ways, and sometimes thinking of self-sufficient ways. And this right here is a rescue sled that was actually for a patient that I took care of when I was still working in Colorado. And the backstory behind this rescue sled is it was from the special operators. So I think it was Delta Force maybe, or SEALs. They were doing their winter warfare training courses in the backcountry that surrounded the area that I was working for. And we got a call at around 11 in the morning saying that one of their guys hurt their knee, can't put weight on it. They're working on getting back to the ski area, and if we could help them once they got back to the ski area. So we gladly said, yes, just let us know when you're getting close. We'll meet you there with a snowmobile and a toboggan, and we can help take care of you guys. Well, this was happening in the backside and in the terrain that needed to close first. So 3 o'clock rolled around. So 4 hours later, we still hadn't heard from this group. And where they described their location, they were maybe only a quarter mile from where we were. There was probably a foot of fresh snow and maybe only 400, 500 feet of vertical change that they needed to travel to get back to the ski area. And it took a group of about 11 special forces about 4 hours to build this sled and to start moving about a quarter mile and about 400 feet downhill. And it, to me, when I saw what they had done and the effort and how just exhausted and gassed these guys were, it definitely was eye-opening to me that if you're doing a rescue like this with each other, it's going to be very taxing. It's going to be very hard, but having some self-reliance is always good, and trying to think of those things. Even if you can move a little bit and search and rescue can meet you and you're in the process, that little bit is definitely still helpful there. So just keeping that in mind, search and rescue, ski patrol, people might not always be able to come out and help you there. Wow. And then just kind of a closing comments on this. So we have some time for questions and comments. We just talked about fatalities. We just talked about avalanches, and it's all in the context of, backcountry skiing or snowboarding or hiking. It's supposed to be enjoyable. It's supposed to be recreation. It's supposed to be something that we use to unwind. And when tragedy strikes, it can be quite traumatizing. And recognizing that stress injuries are there and that these events can be very traumatizing to an individual. I want to just put a plug in for an organization that I've learned about that I think offers some really neat resources, not only for professional organizations like EMS agencies and ski patrols, but I also think it's very applicable to recreational users, and that's the Responder Alliance. And this is with Laura McGladry out of the University of Colorado, I believe, has put together a lot of neat resources that talk about stress injury and the stress injury continuum and how you can recognize if you yourself have suffered from some injury, an actual just potentially in a bad headspace, you could say. So I put a plug in for them. Definitely check them out if you're interested. Just kind of to put that note that despite as fun as this is and how cool backcountry skiing and playing in the mountains are, there can be some harsh realities sometimes. And hopefully with proper courses, education, training, you can avoid avalanches altogether and you can be prepared if the worst case does happen there. But just having a plan for afterwards as well. And then this is my personal contact information. I am always welcome to questions, comments, considerations, things like that. So please reach out to me if you have any further interest in this, or if you're looking for any mentorship, or if you have any questions, advice, things like that. Always happy to hear it and receive it. And then just a little work site right there. But let's open it up to some questions if there are any out there. And thank you, Scott, for putting in the link there for the Avalife. That's super cool information. And they have a couple different tiers. So they've got for, advanced level providers, and then they also have some more simplified kind of BLS basic responder type first responder information there that goes through a lot of what we just talked about.
Hi, TJ. Thank you for your presentation. Very informational. This is one of my biggest fears outside of drowning. But I do have a question for you. If you're involved in an avalanche, how do you know which way's up to start digging yourself out?
It's a great question. And I think it's a misnomer that you could dig yourself out. The cases that I've seen and heard that people were able to self-extricate or dig themselves out, normally something was above or at the surface of the snow. So it was either a hand or their head, and they had the orientation in that regard. The friends that I've talked to that have survived burials, they often tell you they have no idea what direction is up, what direction is down, but they also comment that they can't move. You are encased. As that snow starts to move, there's a lot of energy that's getting put into the snow, and it almost liquefies. And then when it all starts to settle, it almost sets like concrete. And if you're in the snow at that level or underneath it entirely, you could be inches from the surface, but completely unable to move your head, yell out, or anything like that. So there is no real digging out if you're fully buried. If you're at the surface, then that's kind of when you hear the stories in that regard.
What if you were one of the smart people that either had an airbag or you were able to cover your face a little bit? Is there any value in yelling out for help, or are you just using your limited oxygen supply?
Yeah, that's a good question. The airbags are huge because of those reasons. They make you the bigger target, so you float to the surface ideally. You might have an air pocket, and the Black Diamond ones actually deflate after the fact, so you have more space to breathe. And there are definitely stories and anecdotes where people were yelling and they heard the muffled kind of sounds, and there were only a couple inches under the snow at that point. So it was easier for their friends to rescue them. But I think if you were more than a couple inches under the snow, or if your head wasn't near it, it would be hard to hear you. But I think if it was me and I had that space and I could yell out, I probably would be yelling out for quite a while.
Thank you.
All right. Any other comments or thoughts or considerations?
Yeah, in terms of a first aid kit, besides an NPA, are there any other items like that don't come in just a regular, hiking, camping type wilderness first aid kit that would be useful for avalanche safety?
From an avalanche perspective, I think the airway management, it's hard to improvise those kind of things. And then in general for skiing, and what I've noticed ski patrolling actually, tourniquets are the other things that are very hard to improvise, but I strongly recommend having a commercial tourniquet in your kit, because that definitely can save a life. Now in an avalanche, it's a little harder to say, but they can be very traumatic. It would be impossible for a ski edge to go across an artery or to cause a pretty deep laceration. So that would be my only other thing. Otherwise, one of the basic like adventure medical kits with some basic stuff in there, basic wound care should suffice. But those would be my only two things. Things that are hard to improvise are the things that I would carry that are commercially made.
That was great, TJ. Thanks for that. And yeah, as far as a medical kit, I've started carrying an airway, just like a yellow oral airway, and there's little BVMs that are about that big that you can fit inside a pack, and they're really helpful. I mean, if you think about the things that you need right now and that you can't improvise, like TJ was saying, an oral airway, maybe an NP airway, and one of those really small hockey puck BVMs can really do a good job while you're waiting for ski patrol.
And I just put a link into like a simple, this was just a quick Google search, but this is what Dr. McIntosh is talking about there. And yeah, these things are also can improvise a BVM very well. And if you're going to breathe for someone, this is a lot easier than giving mouth to mask resuscitation. Awesome. Well, I hope for those that were concerned, worried, or have thought about the avalanche problem, this was an introduction to how broad and how expansive this whole community in this world can be when it comes to this. And I have been since ski patrolling in my early 20s, so almost 20 years, and I still am constantly learning and constantly training, practicing these skills and trying to kind of figure out better ways to be better at it. So hopefully this kind of starts your curiosity, and reach out if you have any questions about stuff. The UAC is the other best resource that I think is out there if you're local and you're hoping to get into courses and classes.
Yeah, this is fantastic. Thank you, TJ. I don't think you can ever have enough training or talking about avalanche safety, especially as we're going through and the weather's changing as we come to, the lovely Utah spring, if that's what you want to call it. And that increases. And again, why we're going to be talking in the next couple months about like river and water safety because of all the snow we've gotten. I know that's going to increase if people aren't thinking about what we're going to get with that. So thank you so much. Again, we're going to have this on our YouTube channel by the end of the week. For those of you on, if you don't get the Google evaluation from me within the next couple of days, please email me and let me know so you can get that certificate. And other than that, if there's anything else anybody wants to add, please do so. But again, TJ, thank you so much. Dr. McIntosh, thank you so much for joining in and sharing your knowledge as well.